prepare for us. She's independent work, Edwards syndrome. Okay.
Good morning everyone. Myself is Prudhvika. I'm from OMN 6. My topic is about Edwards syndrome.
Après.
Edwards syndrome
इधर बैठे चैट करते रहो.
trisomy 18 is a rare but serious condition. Edwards syndrome affects how long a baby may survive. Sadly, most babies with Edwards syndrome will die before or shortly after being born. A small number, about 13 in 100 babies born alive with Edwards syndrome. Edwards syndrome will live past their first birthday. Causes of Edwards syndrome. Each cell in your body usually contains 23 pairs of chromosomes which carry the genes you inherit from your parents. A baby with Edwards syndrome has 3 copies of chromosomes in chromosome number 18 instead of 2. This affects the way the baby grows and develops. Having 3 copies of chromosome 18 usually happens by chance because of the change in the sperm or egg before a baby is conceived. As you can see here, in the 18th pair of chromosome, there are 3 pairs of chromosome instead of 2. This causes Edwards syndrome. Types of Edwards syndrome.
Sәлеметсізбе чутия.
How serious your baby is affected usually depend on whether they have full mosaic or partial Edwards syndrome. Full Edwards syndrome. Most babies with Edwards syndrome have an extra chromosome present in all cells. This is called full Edwards syndrome. The effects of full Edwards syndrome are often more severe. Sadly, most babies with this form will die before they are born. As you can see here. The second type is the mosaic Edwards syndrome. A small number of babies with Edwards syndrome, about 1 in 20, have an extra chromosome 18 in just some cells. This is called mosaic Edwards syndrome or sometimes mosaic trisomy 18, we can call it as. Then this can lead to minor effects of the condition depending on the number and type of cells that have the extra chromosome. Most babies with this type of Edwards syndrome who are born alive with left at least a year and they may be to adulthood. The third type of Edwards syndrome is partial Edwards syndrome. A very small number of babies with Edwards syndrome, about 1 in 100, have only a section of the extra chromosome 18 in their cells, rather than a whole extra chromosome 18. This is called partial Edwards syndrome or sometimes partial trisomy 18, we can call it. Then, how partial Edwards syndrome affects a baby depends on which part of chromosome 18 is present in their cells. Advice to new parents that
new family
available for whatever your baby needs. All babies born with Edwards syndrome will have some level of learning disability. Like any child, they have their own personality, learn at their own pace, have things that are important and unique to them. Try not to think too far ahead and enjoy time with your baby. Screening for Edwards syndrome. For especially women, if you are pregnant, you all may offer screening of Edwards syndrome between 10 and 14 weeks of pregnancy. This looks at the chance of your baby having this condition. Then diagnosis Edwards syndrome during pregnancy. If the combined test shows that you all have higher chance of having a baby with Edwards syndrome, you will be offered a test to find out if your baby has this condition. This diagnostic test involves analyzing baby's cell to check if they have an extra copy of chromosome 18. Results from the diagnostic test, a specialist doctor or obstetrician or a midwife will explain that the screening results mean and talk to you about your opinion. This is a very difficult situation and it's normal to feel a whirlwind of emotions. It may help to talk to your doctor and family and friends or partners about what you are thinking and how you are feeling about this. Diagnosis of Edwards syndrome after birth. If doctors believe your baby has Edwards syndrome after they are born, a blood sample will be taken to see that an extra copy of chromosome number 18. Then treatment of Edwards syndrome. there's no cure for Edwards syndrome. Treatment will focus on the symptoms of the condition such as heart conditions, breathing difficulties and infections. Your baby may also need to be fed through a feeding tube as they can often have difficulty in feeding. Next, advice for carriers. Supporting someone with Edwards syndrome can be both rewarding and challenging. If you need help or just want someone to talk to, there's lots of support available. Your guide to social care and support providers lots of advice on how you can take time to look after yourself, including getting a break from caring, getting legal support and advocacy, and taking care of your well-being. Then, what are the symptoms of trisomy 18? Babies with trisomy 18 are often born very small and frail. They typically have many serious health problems and physical effects, including cleft palate, clenched fists with overlapping fingers that are hard to straighten, defects of the lungs, kidneys, and stomach and intestine, deformed feet called rocker bottom feet because they are shaped like the bottom of the rock chair. Then feeding problems, heart defects, including a hole between the heart's upper atrial septal defect or lower ventricular septal defect chambers. Then low set ears, several developmental delays, chest deformity, slow growth and small head, microcephaly or small jaw, microgyanthia and weak groin. How is Edwards syndrome diagnosed? Most Edwards syndrome causes are diagnosed prenatally based on antenatal screening with maternal serum marker or by ultrasound finding during the second trimester. What are the symptoms of Edwards syndrome? Those like has been seen before. Low birth weight, small head and jaw, and unusual looking face and head, unusual hands and feet with overlapping fingers and webbed toes. Problem with feeding, breathing, screaming and hearing. Thank you for your attention.
Okay, please. Okay, which information you know?
Edwards syndrome is due to the trisomy of chromosome number 18.
There is a much complex Edwards syndrome, which is clefted Edwards syndrome, in which 1 in 100 children may survive.
Edwards syndrome is due to the trisomy of 18 chromosome and the symptoms like
The trisomy is extra pair of 18 chromosome and it is diagnosed by the several prenatal studies.
It's one of the most serious and rare cases in human beings, and it also has the similar cases with the Patau syndrome. It also has the cleft palate in the born ones, and it is caused at the trisomy of chromosome number 18.
How we know what happened with head and jaw?
That deformity in the head and jaw, they look like a small
Microcephaly and
microcephaly.
Edwards syndrome is caused by the extra chromosome in the 18th chromosome, and it is similar. The symptoms are similar to Patau syndrome.
Edwards syndrome is also known as trisomy 18. It is caused due to the three extra copies of chromosome number 18. And we have some symptoms like we have chest deformity and also defects in lungs, kidneys, stomach and intestine, etc. And also we have overlapping fingers, cleft palate.
Okay. You?
It depends on the surviving of the baby. Mostly babies die after the birth of 3 months.
Patau syndrome is caused when there is an extra pair of chromosome on the 18th pair, and it can be identified when the woman is pregnant between the 10th to 14th week of pregnancy. We can see symptoms like cleft palate and chest deformity, then issues with intestine, stomach, kidneys and etc.
Okay, thank you.
18th chromosome with 3 copies causes Edwards syndrome. There are 3 types: partial and full, and also mosaic Edwards syndrome.
Okay.
Yeah, there are the 3 types of Edwards syndrome: full, which we can see the mutation in all of the cells. There is mosaic, which only have all of the cells are not mutated, and there is partial, which the number of the cells are decreased.
Okay, thank you so much. We are complete.